Hello, my name is Meg Huang, and I'm the Executive Director at the Center for Connected Health Policy. And today we're going to go over some basic terminology that you may hear when you talk about telehealth or look into telehealth. A few disclaimers before we start today. Any information provided in today's talk is strictly for informational purposes. It is not to be considered legal advice. CCHP always recommends that you consult with legal counsel if you are interested in a formal legal opinion. Also, if I happen to show a picture of a piece of equipment or mention a company, know that neither I nor CCHP has any type of financial interest, arrangement, or affiliation or relationship with such a company. One of the things that CCHP does is that we do a state telehealth policy, laws, and regulations report. That is a snapshot of our website, is an interactive map. So you can click on any state and it'll bring up that information for that state regarding their telehealth Medicaid policies, their laws, and regulations. The information currently, as of July 22nd, 2020, on that particular website, on that particular report, is updated through February of 2020. Yes, there have been a lot of temporary changes made in reaction to COVID-19. That is located on a different section of our website. What is on that 50-state map are the current permanent policies related to telehealth. But do know that we do keep this updated, so we will be working on a fall update, so the information will be updated sometime in October. But right now, you can see what the COVID information is on a different section on our website. Just a little bit of background on CCHP. We were established in 2009 as a California telehealth policy organization underneath the Public Health Institute, but became the federally designated National Telehealth Policy Resource Center in 2012 through a grant from HRSA. But we work with a variety of other partners on other types of telehealth projects or connected health projects. I mentioned our 50 state, but we also are the convener for the California Telehealth Policy Coalition, and we act as administrator for the National Consortium of Telehealth Resource Centers. So you probably have heard a lot, if you are new to telehealth, the term telehealth and telemedicine, and maybe you've wondered what the difference is between the two. So they are used interchangeably a lot of times, and also depending on where you're located and who is covering like the services that are being offered, they may have different meanings. However, typically, and in most cases, what telemedicine means is the provision of direct healthcare services to a patient. And it's underneath the larger, broader term of telehealth. So telehealth can include other things such as care coordination, providers interaction, education, and public health. Now, keep in mind, though, again, I had mentioned depending on what jurisdiction you are in and also depending on what payer you may be talking about, they may have their own specific definition for that term. So some states do have a legal definition for telehealth and telemedicine, and it really depends on what terminology they're using. But really, when you're speaking about it generally, telemedicine is direct services, whereas telehealth is that larger term and can include many other things. Here are some other terms that you may hear and you wonder what exactly do they mean. The originating site, and that simply means where the patient is located during the interaction. You may also hear distant site or distant site provider, and that simply means where the provider is located in during the time the interaction takes place. So it's, like they may be in their office or they may be at a hospital. So that's called the distant site. Modality, that's simply what technology is being used to provide the telehealth service. So there are also 3 different types of modalities. Again, more terms that you might hear. Live video, pretty self-explanatory. It's what's going on right now, like a video interaction that takes place in real time. Storm 4, that's the capturing information and sending it to a provider who is looking at it at a later time. They're not looking at it right when that information is coming in. So you're storing that information and then you're forwarding it to that provider. Remote patient monitoring. Now, remote patient monitoring is the continuous monitoring of the patient for a certain condition, and it could be in real time or not in real time. So a real-time example is if you're in an ICU unit, you may have the intensivist not on location physically there with the patient, but maybe they're monitoring from another location and they're communicating with staff that are there right at that time with the patient. A non-real-time example of remote patient monitoring, one a lot of people are maybe familiar with, is somebody with a chronic condition. So say, for example, you have somebody who has hypertension and you want to do blood pressure readings. And that person is taking those blood pressure readings at home and they're sending it to their healthcare provider. That provider probably is not looking at it right as those readings are coming in. Maybe they're looking at it at the end of the day or the end of the week and then getting back to the patient if they need to. So it's a continuous monitoring, but it's not taking place in real time. It's not in real time of when the provider is seeing that information. So these are your three sort of basic modalities of telehealth and how the service is delivered. Now, what happened with COVID is they've dropped in almost sort of like a fourth modality, and that's the telephone or audio only. So before COVID, actually in a lot of places, they did not include telephone within their definition of telehealth or telemedicine, whichever term they were using. In a lot of places, they actually explicitly included. They would say, like, this is what telehealth means, and say, and it does not include phone, fax, or email. So telephone in a lot of places were explicitly excluded, but because COVID happened and policymakers realized not everybody has maybe access to telehealth because they don't have like sufficient connectivity or they don't have like a smartphone or a laptop, they needed to use telephone as a way to reach those people. However, that is still like in a little bit of a gray area. So you may see a lot of policies, especially like during COVID when they were doing temporary policies saying like, so this is our temporary policy for telehealth and telephone. But now what we're starting to see is some states at least are incorporating telephone or audio only within their definition of telehealth. So where that's going to land, not quite sure, but we're already seeing changes of some jurisdictions, some states including it in their term for telehealth as well. Now you may have heard a bunch of other terms. I wonder what's the difference here? What do these mean? Like e-consult or e-visit or virtual check-in or telemental health. Keep in mind that all these are just sort of special names that they give for something specific, but they still fall underneath of using one of those other three modalities. So for example, an e-consult, that means when two providers consult with each other and they're doing it over like one of the modalities. They may be doing it over live video, they may be doing it over store and forward, they may be doing it over the phone. So it's just sort of like another name for just an action that they're doing, but it's underneath the umbrella of telehealth and it's using one of the telehealth modalities. Telemental health, you'll see this often when there is some sort of specialty such as mental health, behavioral health, dermatology, they'll put the word tele in front of it. And that simply means delivering that type of service for that specialty via telehealth. So these are, again, don't get them confused. These are just sort of like other terms that are used for something, a specific action or for a specific category underneath the telehealth umbrella. So who decides whether I can receive services via telehealth? So what is the deciding factor? And the way that it's set up is that telehealth right now, technically, it's not illegal to use it. A lot of where the policies are is really around like, not that you can't use telehealth or you can't receive services via telehealth. There are laws that you have to follow, such as like you need to be licensed or, you know, this is what you do with telehealth when you're trying to prescribe. But there's nothing that says if you provide a service via telehealth, it's illegal. It's totally illegal to do that. The bigger question is like whether you would get paid to deliver that service via telehealth, or whether if you're a patient, whether that service is covered for if it's delivered via telehealth. And where does that decision lie? Well, a lot of time it lies with the payers. And for those who are not familiar with, you know, what that term means, these are the people, or these are the entities, the companies, the health plans that really cover, you know, the service that's being provided. So how they set up their policies really determines on like what is being offered and what's going to be covered. So depending on who covers your insurance, they have their own policies in regards to telehealth. So you have Medicare, which is a federal program. Usually it covers seniors, but there's, you know, certain categories of patients who may have certain conditions that are also get Medicare, but for the most part, we're talking about senior citizens. Medicaid, that's a state program and it's state and federal funding, but the states really run it. And, you know, again, the particular populations that they cover. And then you have commercial health plans that are, you know, employer plans or health insurance you purchase. And then there's always the category of you. So you're paying out of pocket. You pay for the service yourself. And all of these different payers have like their own different rules and how and what they would cover if the service was delivered via telehealth. So it can kind of get confusing, definitely, if you're a healthcare provider and you're providing services via telehealth, and then you have, a certain number of patients, and they all fall into one of these other categories. There means different rules apply then in like what you can do for that patient via telehealth. And then if you're a patient, you need to figure out like who is covering your healthcare services, if it's one of these folks, or are you paying out of pocket, and then determining like what their rules are. So those are just a couple of basic terms that you may hear if you're new to telehealth that I thought might be useful if it was clarified for you, and see how it works in with like your telehealth policies and like what can be covered and what services you can access and what services are covered if you're providing them. So I hope that's been helpful, and we will talk to you soon. Thank you.